I'm Leah Jaspers, and I'm on the communications team for the health department during our COVID-19 response. And here with me I have Renee Giuliani, and she is a contact investigator for the health department during this response. And thank you for joining us today.
You're very welcome.
We are going to talk to Renee about what to expect if you test positive for COVID-19 or if you're a close contact to a positive for COVID-19. And she has a lot of great information for us today, and we're going to go over 5 different frequently asked questions from Facebook or our hotline, and hopefully you have a better understanding of just, what to expect during this time. So we'll go ahead and get started.
Sure.
Question number 1 is, what should I do if I think I was exposed to COVID-19?
The first thing you should do is get tested. The health department has free testing sites all over the county. We've also partnered with other agencies for improved accessibility of testing around Chattanooga. The hotline is 209-8383, and they can give you the information for the current testing locations and the dates and the times, and the partners that we also test with.
Thank you. And if you test, once people go to these testing sites and they get tested, what should they expect if they test positive for the coronavirus?
Okay. If they test positive for coronavirus, when we call them and speak to them on the phone, it's very important that and we verify who they are. It's very important that they are honest with us with the information that they provide, because they don't always understand why the health department is calling them. And I emphasize that it is the role, or one of the many roles, of the health department to aid in the prevention of disease, and just like we did with hepatitis A, and spreading the disease. So we want to not have so many positive cases, because people really don't understand what they need to do. They just know that their employer told them to get tested or whatever. But if they do test positive, we go through we go through the questions with them of when they had the onset of symptoms, such as, did you have chills, did you have fever, did you have diarrhea, body aches, loss of taste or smell, any other symptoms. We also look at their medical history to see if they have any underlying medical conditions that could affect this, especially if they have breathing issues. And we just talk about what they need to do, as far as that they need to isolate, and what their family needs to do as well.
Okay. Yeah, and what are some things that people can do to protect their family or people that they live with if they do test positive and they have to, that's where they live. So what are some things they can do to keep their family members or people they live with safe from not getting COVID-19?
What they can do, first thing, is be honest with the family and let them know that they've tested positive. I had one case where one of the family members was afraid to tell the other family member and didn't say anything, and it ran through the family right down to the younger children. So the first thing is to be honest with them, tell them that you've tested positive, encourage them to go get tested. Now, things that you can do in the home. The first thing is that the person that tested positive for COVID-19 needs to isolate themselves. That means getting as far away as you can, or as possible, within the home from everyone else, meaning staying in a separate room that nobody else will be in for 7 to 10 days. If possible, if you have a second bathroom, that individual use that one restroom facility If there is one restroom, then that individual would have to come out with a mask and sanitize common areas. They do not need to be eating with the family at the table. They also need to practice hopefully increased hand washing, covering of sneezes and coughs, using soap and water and washing their hands for a minimum of 20 seconds, or using an alcohol-based hand sanitizer. Another barrier in the home is contact surfaces that they don't think that they would be able to catch a virus on. It could be the handle for a refrigerator, it can be a light switch, it can be the faucet in the bathroom.
Wow.
It could be the drawer pull to when you go get a utensil to eat. So all of these surfaces really need to be sanitized frequently, even if the person is in their own area. So they need to be in their own area, as far away from the family as possible. The family members need to quarantine for a minimum of 14 days.
Okay.
And their quarantine date actually hinges on the well date of the person that tested positive. So the disease, or the virus, is spread airborne, it's contact. It can be from sharing a utensil, from kissing somebody, exchange of body fluids by kissing someone. Sometimes things that we don't normally think about. If they do not have a dishwasher in the home, then the dishes should either be washed in hot soapy water, have a little bleach added to that, and the dishes air dried, or everything go through a dishwasher if there is a dishwasher. That would be the preferred method of washing the dishes, or even simply using disposables for the individual.
Okay. Wow, that's great information.
Yeah.
A lot of practical things people can do at home.
Yes.
In that answer, you mentioned quarantine and isolation. Do you mind giving us a, just kind of the definition of each and letting us know the difference between those two?
Sure.
Okay.
Quarantining is you're staying home, you're not going out of the home, you're not going to the movies, you're not going to the grocery store, you're not visiting friends, you're not having friends come to your home and visit you. You are staying in. If you can have the aid of somebody to go to the grocery store for you and perhaps leave groceries at your doorstep or have groceries delivered, that can be another option. A lot of grocery stores are now doing home deliveries where you can go online and select what you want and have a time that you'd like it delivered. You don't need to be out, period. Coronavirus, or COVID-19, can take 14 days to develop symptoms. So I've had a ton of people this week tell me that, what do you mean I'm positive? I'm not sick, I feel fine. I don't have a fever, I'm not, I don't have the chills, I don't have loss of taste. I don't have any of those symptoms. Why can't I go to work? Because it can take 14 days for your body to show those symptoms. So you may not get sick until day 13 or day 14.
Wow. Okay.
And isolation is really one step above the quarantining. That means you are doing the same thing as quarantining, but if you are living in a home with other individuals, you are staying as far away as possible from them, using masks and just being mindful about their needs as well.
Okay.
That you're not, touching things that they would touch. And one of the nastiest things is a cell phone. There are some households that have one cell phone for the entire household. So maybe that cell phone should be sanitized down and given to somebody else in the home that can make calls and so on.
Mm-hmm.
But that harbors a lot of germs and
yeah, and we carry
bacteria.
our cell phones with us most places these
Yes.
days, so that's important to
Yes.
To clean the cell phone and other items that you touch a lot, so.
Another item is if you are hand washing dishes, you can actually sanitize a sponge in a microwave. The people I've spoken to that don't have dishwashers, I encourage them to take that sponge, wet sponge, and microwave it for 20 to 30 seconds. And not to touch it, to take it out with either two utensils or tongs or something so they don't get burned. But that can harbor viruses and bacteria as well.
Wow. Well, thank you for that. And with everything, starting to reopen and people going back to work, a lot of questions we're getting in the hotline is, people calling to want to know if their employees were tested and what their results were. And, or people wanting to know if family members have it and if they tested negative or positive. So, is the health department allowed to give anyone's results, negative or positive, to employers, to family members, friends, or any others that are calling to want to know what the test result is of someone other than themselves?
Absolutely not. The health department takes it very serious to maintain protected health information. We cannot provide anyone's results to anyone. It is against the law to do that. I've had people say, well, I got tested with my aunt and my uncle. Can't you tell me, if they tested positive or not? And I said, I'm very sorry, I can't. I'm not permitted to. I can just tell you what you tested, and I can't tell them what you tested either. Employers, absolutely not. Some people are a little bit guarded, I should say, about when we ask where they work and their telephone number and so on. They have the feeling that we're going to call the employer and say, oh, by the way, Mr. Smith tested positive for COVID-19. We cannot do that. The reason why we get that information is sometimes there are clusters of individuals in one place that do test positive, and where we can help the employer is to see what practices they have in place to protect the employees there to prevent the spread of the virus.
Okay, so you could contact the employer, but only to advise that business place of cleaning and hygiene practices and things like that, not to provide the name of an employee.
Absolutely not.
Okay.
It is never divulged, ever. Not even if it's male, female, or by the way, you have 3 cases that tested positive. Nothing is said to the employer in that manner, ever. It is the employee's responsibility to let the employer know that they tested positive, especially when many of these employers are encouraging your employees to go get tested. I've seen a lot of that this week. I've had that response from people. They've requested that we get tested.
Okay.
So when I call them, I'll say, have you notified your employer yet? And most of them have said yes.
Okay. And that's just so, in case they want to let the employer know so that they can let the other people in their area know, maybe.
Absolutely.
Okay.
If you think of somebody in construction, there's shared equipment that people use. Or if you're on a piece of machinery, then that piece of machinery would need to be sanitized down as well.
Okay.
And also people working with masks on and so on. So, I spoke with one company, somebody in HR, and they said they have taken it very seriously. I asked, what have they been doing to promote safety in the workplace to prevent the transmission of the virus? And she was spot on. Actually, she even told me she's gone to our website and downloaded some of the materials to hand out to the employees.
Wow, that's great. That's great. And yeah, we do have resources on our website for anyone who wants to download materials or handouts that you can hang around the workplace so that people know proper hygiene and safe measures during this time. And thank you so much, Renee, for all of this information.
You're welcome.
It really, I learned a lot during this interview, so I really appreciate you being here. And just remember, if you have any questions, you can call our hotline at 423-209-8383, and they'll answer any questions you may have. Thank you.